For our offices in San Diego, we see a lot of our clients who either have their healthcare providers or want their healthcare providers to be under the SHARP hospital network. And it's a big deal for someone who really likes the way that one of the largest hospital networks in San Diego treats their patients and our clients. For those folks, it's almost a reflexive response to recommend the SHARP Direct VIP plan available in San Diego in 2025. So today, let's talk about the 5 things to look at on the SHARP Direct VIP Medicare Advantage plan. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP, or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. The SHARP Hospital Network in San Diego is arguably the most San Diegoist of hospital networks. It started in San Diego, it has grown immensely over the last few decades in San Diego, and a lot of folks have either had that coverage through their employer or through a health exchange plan, or now through Medicare with a SHARP doctor. And over the last few years, SHARP has launched their own in-house SHARP Medicare Advantage plan, with the most recent iteration being this SHARP VIP plan. So instead of having to go through a separate Medicare insurance plan, a third party, if you will, to get the full SHARP network, SHARP as an organization has brought it all in-house and created their own plan, which frankly is pretty good. All right, first up today, let's take a look at really the first thing that we usually look at with any Medicare Advantage plan, which is the monthly premium and the deductible that's associated with that plan. For this SHARP VIP plan, it is pretty easy because of the fact that there is a $0 cost for either the monthly premium or the deductible. But also remember that the monthly premium, it may be $0, but to be eligible for these plans, someone must keep their enrollment in both Medicare Part A and Medicare Part B, which is pretty easy to do for Part A because it is done automatically for most beneficiaries, and there is usually not a monthly cost for like 99% of beneficiaries. But for Part B, there is a cost, which in 2024 was $174.70, and in 2025, it'll likely be around $185 or thereabouts. So although there is that $0 monthly premium for the SHARP VIP plan, one would still have to pay whatever that increasing cost is for the Medicare Part B premium monthly. Also, because there is no deductible, it means that the copays and the co-insurances for services under the plan will kick in from the very first dollar the beneficiary spends, instead of having to wait for an initial amount or spend a certain amount of money that has to be spent first before the benefits kick in. So that's pretty good too. Speaking of daily usage benefits, let's talk about the types of benefits that are typically used by most Medicare beneficiaries, because these are sort of the day-to-day services, the primary care doctor's visits, the urgent care visits, and maybe even occasionally the emergency room visit. For doctor's visits, there is a $0 copay for both the primary care and specialist doctor's visits. And also keep in mind, because this is an HMO style plan, it'll mean that in order to really get any specialty care, someone would first have to go to their primary care physician first, get a referral, and then they will have to get an approval to go see a specialist. That's just kind of how the system works. On the other side of that, for situations that may be more urgent than getting an appointment to see one standard primary care physician, a trip to the urgent care is going to have a copay of a $30 per visit copay. Now keep in mind, this is like those kind of medical clinics that can assist you on a walk-in basis for things like coughs or stitches, or maybe even something minor like a broken finger, but they're not really going to be for an emergency. So, I mean, the ambulance would not take you to the urgent care. For that is going to be the emergency room, and on the SHARP VIP plan, the cost to go to emergency room would be a set copay of $90, which is pretty good looking at the crowded field of emergency copays in San Diego, but still, it's going to be the highest of those 3 types of visits that one can have. Also, this copay is really just going to be for the entry into the emergency room. It doesn't account for the other costs, for the other services that someone gets in the emergency room. And ultimately, it gets waived in the end if someone does get admitted into the hospital. Now, with some of the more serious services out of the way, let's talk about some of the extra benefits that come with the SHARP VIP plan, because Medicare Advantage plans will cover all the normal things that will be covered under original Medicare. So that's Medicare Part A and Part B. So things like hospital and medical coverage. but they will also often offer extra benefits that are not covered under original Medicare to provide some more services to their enrollees. One of this is going to be dental coverage, and the SHARP VIP is going to have dental coverage run by Delta Dental that is comprehensive. So that means it is a lot more than just cleanings and fluoride and x-rays, but also includes things like crowns and dentures and root canals and more complex procedures for a set copay. And although the standard comprehensive dental does come with the plan in an HMO format, for those folks who would prefer a PPO style comprehensive dental that would expand the dentist that they would be able to see and have coverage for, there is an option to do that, to upgrade to the PPO comprehensive dental, but that will have an additional monthly premium of $40 a month. So that is a nice option too for those folks who want it. Another really great extra benefit, specifically for those folks who need them, is for hearing aids. Now, this is another thing that strangely is not covered under original Medicare, and thus is offered as an additional benefit on the Medicare Advantage plans. And the SHARP VIP plan has a very healthy hearing aid benefit that has an allowance of $3,800 that can be used towards purchasing hearing aids. And that is limited though to every 36 months. So I think this is probably the highest dollar amount that I have seen, but it's also one of the longest renewal timeframes, or like usage timeframes as well. So that is just something to keep in mind. But all that being said, the hearing aid benefit is so helpful for those folks who need to have that type of coverage and that type of benefit, and would want to have a higher allowance for it. But also, you know, they don't replace them less than every 3 years. Last up today is another extra benefit that is becoming almost passé at this point because it is so common. But despite its almost ubiquitous offering for Medicare Advantage plans, it doesn't seem like that many people actually end up using it. Except our clients, we get so many folks who come in on a monthly basis to help get this filled out and figured out and sent in, which is the over-the-counter benefit. What this is a quarterly benefit of allowance of $150 that can be used quarterly on the SHARP VIP plan to buy things that would typically be found in the pharmacy, but doesn't really require a prescription. So think about toothpaste or bug repellent, Advil or Tylenol, whichever type of person you are, medicated bandages, or even just regular old Scooby-Doo Band-Aids. Either way, the SHARP VIP plan has a $150 OTC benefit that can be used to buy non-prescription related health items at places like Walmart and CVS and Rite Aid, and really quite a few other places. So there you have it, the SHARP VIP plan available in San Diego in 2025 for those folks who really like and want SHARP healthcare system as their provider network. And this is not just limited to the big hospitals, especially in the North County part of San Diego. There are groups like Graybill and Arch Partners, formerly Arch Partners, now Palomar Health, are really going to have great healthcare providers that don't just work with any run-of-the-mill health insurance plans. But in addition to the SHARP Doctors Network, the benefits are pretty good too, and are a great fit for folks who have that doctor's network specifically and could utilize the extra benefits that come along with the SHARP VIP plan. So that's it for today for Michael's Medicare, and if you or somebody you know has questions about this or really any other Medicare plan issue, feel free to reach out to us at the information down below. We're happy to assist them over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe so you can get updates when our newest great Medicare content comes out every single week, and also doubled up during AP. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.